Hi, I'm Susan Kimberly, the Behavioral Health Specialist here at Carolina Advanced Health. And in this video, I'm going to be talking about lower risk alcohol use. So to help clarify, how much is too much? Many people have questions about their intake or that of a loved one. So first of all, it's important to define how much is a drink. So that would equal a 12-ounce beer, 8 or 9 ounces of malt liquor, 5 ounces of wine, or a 1.5 ounce shot of 80 proof liquor, such as whiskey, gin, rum, etc. So for example, in a bottle of wine, there are the equivalent of 5 drinks. What's considered low risk drinking? Well, there are differences for men and women. So for men, no more than 4 drinks on any given day, and no more than 14 drinks per week. For women, no more than 3 drinks on any given day, and no more than 7 drinks per week total. So in other words, to stay low risk, you would need to keep within both the single day and the weekly limits. So higher risk drinking, therefore, would be for men drinking more than 4 drinks a day or more than 14 a week, and for women, more than 3 drinks a day or more than 7 per week. So too many and too often is too risky. Why are women's limits different than men's? So some of it's kind of common sense. On average, women weigh less than men do. Alcohol disperses in body water, and women have less water in their bodies than men do, and so a woman's blood alcohol concentration will be higher after drinking the same amount as a man. Well, even low risk drinking does not mean that there's no risk. So even lower risk drinkers can have problems if you drink too quickly, take certain medications, are pregnant or trying to conceive, or have health conditions that can be made worse by alcohol. For example, liver disease, depression, diabetes. You may be thinking, I drink more than those limits. Does that mean I'm an alcoholic? Well, no, not necessarily. A lot of factors include how much, how often, and how quickly you drink, how young you were when you first drank, whether you have a family history of alcoholism, and also, as mentioned, what your other health risks may be. Heavy alcohol use does increase your risk of developing alcoholism and alcohol-related problems, causing problems with your relationships, work, or legal issues, or causing injury to yourself or others. It may be helpful to ask yourself the following questions. Have you ever felt you should cut down on your drinking? Have people annoyed you by criticizing your drinking? Have you ever felt bad or guilty about your drinking? Have you ever had a drink first thing in the morning to steady your nerves or get rid of a hangover, sometimes known as an eye opener? If you're not sure, then you can always get non-judgmental information about the impact alcohol may have on your health from your Carolina Advanced Health provider. So you can call 919-445-6000 to schedule an appointment, or you can visit rethinkingdrinking.niaaa.nih.gov for more information and for some screening tools and strategies if you decide that you would like to cut back.